main theatre of the Axim Government Hospital in the Western region has been shut down, prompting fears lives could be lost through preventable deaths. The theatre, a point of referral where more than 900 surgeries are conducted annually, has finally been shut down due to its dilapidated state. Correspondent in Athalia Kwanzaa has more.
The Axim Government Hospital, located in the Nzema East municipality of the Western region, was established more than 90 years ago. However, one of the critical units of the hospital, which is its theatre, set up some 40 years back, has never seen any major renovation.
One, ceiling leak. Okay. Or leak in situ kesipa, phone ring of our walls. The onyadin po ebetu akade edade besi wonkuna of our walls no.
Dilapidated equipment are visible everywhere in the theatre. The hospital's only sterilization room is out of order for months.
Machines bienya or high offered autoclave. Autoclave na edinya nyamana yedi operation no. Amani want to my operation but autoclave no I say the entomb
That is an excerpt from our visit to the facility last year, when the 40 years theatre was on the edge of collapsing. It's 8 a.m. in the morning. I have arrived here at the Axim Government Hospital, only to see one of the critical units of the hospital close down. That is the theatre. This time, the theatre has become a skeleton, virtually empty, but its dilapidated nature can easily be seen. Principal Health Service Administrator of the hospital, Domi Gospel, describes the situation as unfortunate.
Where we are currently used to be the operating theatre of the hospital. It looks empty, as everyone can see, because the structure is being shut down temporarily for renovation works. That is how come it looks very empty and probably wretched. This comes as a result of the fact that this hospital, being one of the oldest ones in the region, having been established as far back as 1925, have not seen any major rehabilitation or facelifting project. Consequent to that, most of the structures have become weak, dilapidated, so to speak, especially where we are now, the theatre. And as professionals, we sent an SOS out there that if nothing is done about it, we cannot continue to work in an environment where we feel unsecured, very unsafe, not only for ourselves, but for the lives of the people we bring here to operate upon.
He explains the challenges of atmospheric air finding its way into the theatre during operations, a situation very harmful to the patients.
Meaning from where we bring people, put them on the operating table to operate upon them. Though thankful to God that lives were not lost as a result of working in this very appalling condition, that is not to say that it is anything to write home about. So as you can see, the structure is such that this place is being closed with a wooden frames and a louver blades with these openings from outside. That makes atmospheric air or air from outside get direct access to the operating room. Something we all know medically is not acceptable. But that is the condition in which we were finding ourselves. So the idea now is to close this and make it such that it can befit the modern trend of all operating theatres, not allowing atmospheric air to come in. We close it with aluminium glazed doors and make sure that over here, it used to be only one centralized theater for both minor and major operations. But now we wanted it in such a way that we can have 2 theaters, both one minor, one major, so that even in the unlikely event that 2 critical cases arises at the same time, they could be well taken care of. As we move from here...
The roof leaks badly. Dummy Godswill takes me to other parts of the skeletal theater.
That's where we are now, is the doctor's room. This is supposed to be the office of the surgeon, who is in charge of this hospital and who does all the operations. If you look at this environment, I do not think that it befits even. So it goes to speak the condition, the deplorable condition in which people who are willing to serve God, nation, and country are prepared to work. We have been in this situation for a number of years now. And we have gotten to a point where we think that the authorities out there must know what is happening.
Care units of the hospital into a theater for emergency cases such as cesarean.
So where you see me standing was previously the NICU, but because of situation they have to change it to the theater, and it is used for emergency cases. For Joy News, I am in Athalia Konsa, Axim Government Hospital.